Hello everyone, welcome back to my channel. In this video, let us see about the psychiatric health nursing bits. The use of vulgar or absence of language is common in schizophrenia and it is called as coprolalia, neologism, echolalia, echopraxia. So absence of language or vulgar language we call it as coprolalia. Persistent, unrealistic, intensive fear of an object, place, or situation is seizure, phobia, hysteria, illusion. And the answer is phobia. Grandeur delusion is a typical symptom of schizophrenia, mania, delirium, dementia. And the answer is schizophrenia. So, delusion is seen in schizophrenia patients. Lack of physical movement is seen with catatonic schizophrenia. It is akinesia, orthopnea, apathy, amnesia. So, lack of physical movement, it is akinesia. The term schizophrenia refers to intellectual deterioration, splitting of mind, neurological illness, psychological illness, and it is a splitting of mind. A person who is avoiding becoming aware of some painful aspect of reality is. So, who is avoiding, that is denial, projection, deteriorating, acceptance. And the answer is denial. A person who habitually expresses anxiety through physical symptoms is using dash as defense mechanism. Habitually expressing anxiety through physical symptoms. Projection, conversion, regression, hypochondriasis. And the answer is conversion. A side effect of electroconvulsive therapy that a client may experience is complete loss of memory for a time, postural hypertension, orthopnic hypertension, confusion after a time of treatment. And the answer is confusion after a time of treatment. When a client openly masturbates, most appropriate behavior of the nurse would be not to react to the behavior, restrain the client's hands, punish the client, state that such behavior is unacceptable. And the answer is state that such behavior is unacceptable. Prominent symptoms of paranoid schizophrenia lasting for at least 1 month are delusion and hallucination, poverty of speech and apathy, disturbed relationship and poor grooming, bizarre behavior associated with drug use. And the answer is delusion and hallucination, which is lasting for 1 month. A disturbed client starts to repeat phrases that other have just said. This type of speech is known as imitating others' phrases, echopraxia, echolalia, neologism, stammering. And the answer is echolalia. Clients with a history of alcoholism with Wernicke's encephalopathy associated with Korsakoff syndrome is treated by injection thiamine, injection tocopherol, diet of riboflavin, high carbohydrate diet. And the answer is injection thiamine. When talking about alcohol and drug abuse, the nurse should be aware that most polydrug abusers also have abuse of alcohol. Most alcoholic become polydrug abusers. Addictive individuals tend to use hostile, abusive behavior. An unhappy childhood is a causative factor in many adductors. And the answer is most polydrug abusers also have the habit of abuse of alcohol. The nurse recognizes that dementia of the Alzheimer's type is characterized by areas of a brain destruction called senile plaques, hypoxia of selected areas of the brain tissue, produce remission and exacerbation, aggressive acting out behavior. So dementia of Alzheimer's type, it is areas of the brain destruction, we call it as senile plaques. An adolescent is diagnosed and he is having anorexia nervosa. The nurse understands that etiology of this disorder is an unconscious fear of growing up, anger directed at the parents, feeling of unworthiness, a low self-esteem. And the answer is unconscious fear of growing up. Drug abuse is best defined as a physiological need for a drug, a physiological dependence on a drug, a compulsion to take a drug on either a continuous or periodic basis, an excessive drug use inconsistent with acceptable medical practice. And the answer is an excessive drug use inconsistent with acceptable medical practice. Mentally healthy individuals are defined as those who have insight into their own problems, do not exhibit pathological symptoms, are able to meet their own basic needs, are free from both physical and emotional problem. And the answer is are able to meet their own basic needs. The most common characteristics of children who are emotionally disturbed is that they respond to any stimulus, respond to little external stimulus, seems unresponsive to the environment, are totally involved with the environment. Emotionally disturbed child, they seem unresponsive to the environment.